Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Chief Public Health Official for the City of Nashua and the Director for our Division of Public Health and Community Services. And I'm joined today by Latonya Muccioli, who is our Housing Services Officer and newly hired by the Division of Public Health and Community Services for the City of Nashua to work with us to address issues and matters with housing stability, housing instability, and addressing the crisis that we've seen in our city and in our region with homelessness. So I'm going to just talk a little bit, Latonya, about the creation of this position in response to what we've seen with regards to homelessness. So homelessness is a social determinant of health, which is a variant or a condition, in our society that impacts a person's ability to live as healthy as they can. It's preventable, homelessness, and it has become a huge public health issue, not just in Nashua or in New Hampshire, but across the United States. Over the past 3 years, the impact of COVID has actually exacerbated this condition for many people in our community. And this position that we've created, that you have so graciously stepped into, will be responsible for helping us come up with a strategic way of addressing this issue and provide oversight to our response to mitigate homelessness and the day-to-day things that go into the activities, the plans, meeting with our partners, to get a real handle on this. You'll help us develop some strategies and collaborate with us as we meet with our federal folks at the state level, locally, and regionally to address this issue. So, Latonya, this is an opportunity to share a little bit about how you see yourself in this position, as well as why you decided to take this position, because there's quite a bit of, if you think about what's happening, we're starting to see more and more homelessness within the city of Nashua, of those experiencing housing instability, and the people that are now starting to experience this issue with housing instability look very different than what we're used to in our community.
Absolutely. Thank you, Bobbie. So I will start by kind of explaining some of my background and what led me here. So my expertise is in elder services. I went to school and got a master's degree in psychology, and I've always worked with the elder population. I had served as the director of a memory care unit at an assisted living during peak COVID time. And then I transitioned into a role as a director of elder services for a nonprofit. There, unexpectedly, I came across numerous individuals who had been experiencing homelessness. And when the average person thinks about, what homelessness might look like, a lot of people seem to forget about that population. So as I was working in my previous role, there were a lot of barriers in terms of stability for housing for individuals that are chronically ill, elderly, or mentally ill. So the New Hampshire shelter system does not accommodate individuals that are elderly and need personal care services. Emergency shelters are just not equipped with the manpower to provide that personal hands-on assistance. So a lot of these folks are often referred to city welfare and other resources, but there's not really any kind of emergency respite for these individuals. Yeah. So that's kind of what sparked my interest. I had gone to a couple of continuum of care meetings with the city of Nashua, and I had learned more about the homelessness issue and really started to become more interested in making a difference down that lane.
Yeah, and we're very glad to have you on board, especially with your experience with working with, like you said, a population group that sometimes is not really thought of, with regards to experiencing homelessness, because we tend to think of the elder population or older adults, being in homes, taking care of, in homes, and not even, considering there are, again, social determinants of health, or there are things that can happen that can change that circumstance for an older adult. If a person loses a spouse and, and if they were renting and then they can no longer, afford the rent in that apartment, or if something happens, catastrophic medical thing that happens that then runs up big bills, and then you have to pay those medical bills, and then, some of these other things, are then impacted and folks aren't able to maintain their housing, or just the high costs of rents. So we're learning and we're hearing more and more about that, in the state of New Hampshire, and as I said, in many other places across the United States as well. And so it's not this crisis that we're facing, because it is, it's a housing crisis, tends to have, an impact on certain population groups, and we're starting to see that more and more. At the City of Nashua's Division of Public Health and Community Services, in particular in our welfare department. Talk to me a little bit about like what your vision was. And so you see this position advertised, right? And, you have a glimmer of hope, about making a difference. What did that look like for you?
So going back to attending a lot of the Greater Nashua Continuum of Care meetings, I was just taken back by how so many folks in our community want to collaborate and work to solve this issue, and help everyone who's being impacted. Whether you're being impacted or somebody is impacted, I think most people at least know somebody who's impacted by housing instability in this current environment. Mm-hmm. So I was just interested in really kind of taking a leap and seeing where this journey brought me, and also getting to work with a different population. So while we had talked about older adults being part of the people that are experiencing housing instability, it's a much broader population. There's children that are being impacted by this. I've never worked with children, so it's just really sparked my interest, and I really want to bring my elder expertise into the role, while learning about the other individuals in this population and collaborating with all of our community partners on a solution.
Yeah, and it does. It takes, so there's an old African proverb, Black History Month, African proverb, that it takes a village. Mm-hmm. And it really does. It really does take the community partners, community members, it takes policymakers, it takes legislators at the local, and at the state level, really doing sort of like this wraparound and getting a really good look at what is happening and how do we get our hands on this, to handle this in a way that is, that can be looked at as a protective factor in maintaining housing stability, for those who might just be on the brink, right, of losing, their housing. And so the community working together is really, really important. And you mentioned the continuum of care. And so the continuum of care is a network of agencies that gather. We actually meet the first Wednesday of the month. And it is an open meeting. So people from the community can also attend that meeting, to learn about the efforts that are being put in place with regards to the organizations that are there. And many of those organizations represent services to help mitigate, stop, prevent people from losing their housing, or, if and when they do, have some resources to help get them into either temporary housing or placements, so that they can move forward and get themselves back on track with housing. So I'm hoping that we'll be able to have someone from the Continuum of Care join us here at Public Health Matters to talk a little bit more about that, because that is, across the U.S., it's a movement that's done. It's funded by HUD, Housing and Urban Development at the federal level, for states to make sure that they have agencies and resources, to address housing instability, and homelessness. And so you've had the opportunity to participate on the COC in your previous role. When you sat in that role as a director of elder services, what was it that you learned about the continuum of care and how it would even support that population as far as from your perspective?
I was able to learn about a lot of the nonprofits that were local to Nashua. Mm-hmm. In my previous role, we focused on the state of New Hampshire, but we did have clients in Nashua area. So I learned a lot about what the nonprofits do, and there's a lot of things that I was surprised to learn. There was some assistance with first month's rent or security deposits. Also, one of the biggest gaps was finding assistance with moving.
Right.
Because a lot of these folks, especially individuals that may have a disability or other challenges, aren't able to move their things. They may not drive anymore. So just being connected with people and finding different resources that could help was very helpful. And it was nice to know that everybody, again, is collectively trying to work on solving this problem. It's nice to live in a community and work in a community where everybody's hands on deck.
Right.
And a lot of the people who attend the meeting, they might be at the director level, but they know exactly what's going on. They know individuals that are experiencing homelessness, and they're connected, which is very nice.
Yeah. And, I think that just goes to show, like in the community, in particular in Nashua, how well, our organizations do work together. And sometimes it's really about like that coordination. So the continuum of care, because the agencies have very specific responsibilities in their deliverables, some of the work that we do might be just like touching on the issue, right? And so in the role that you're now in as the housing services officer, the goal is to help have better coordination with these organizations and within the city itself to come up with a strategic way of addressing this, set some goals, come up with some objectives, and then see some outcomes that really see us moving the needle. Because right now, what it looks like is that we're seeing an increase in the number of individuals that are, and I say like on the brink, because it only takes like one thing, right, for a person to then not have the resources that they need to maintain, their housing. And so I'm excited about this role. Having written it up myself, having created the role, again from a public health perspective, because we find ourselves, we've gone, Latonya, as you've seen, we've gone from crisis to crisis. And so when I started back at the health department about 8 years ago, we were just coming into the opioid epidemic, and we're responding to that crisis. And then we went from there to another crisis, and then we went from there to another crisis, and then we went to a pandemic. Right? And all of these things lend themselves to a very basic human need, which is housing. Maslow's hierarchy of needs, as a psychology major, you know who Maslow is, has this framework that you have to take care of those very basic things in order for a person to actually come to a place of looking to do preventative things. Like, I'm not going to look to prevent anything, right, with my health, chronic disease, and acute infection, if I have to focus day to day on where am I laying my head tonight. We talked about older population, adults. Think about that even with children, right? How can a child do well in school if they're not in a place where they have to think about their housing, or the instability of housing or the threat thereof. I've had the opportunity to read a couple of different books that focused on this whole situation with homelessness and housing instability and what's been going on. And this isn't new. This has been going on since the 80s. And it's just getting more and more complex for us. You'll hear our welfare officer talk about the complexity of the cases that they're now starting to see. When people come in to ask for assistance, it's more and more complex because there are other things that families are facing that then, again, that one little thing that's the tipping point that then lands them into a situation where they're looking for outside services. And so this is a nice, big, hefty, I can say healthy too, hefty role that you're stepping into. And so talk to us a little bit about you're about what, 30 days in?
30 days in.
30 days in.
And
How has it been? On today's day? Well, happy 30th day anniversary. Talk with us a little bit about how has it been in the first 30 days?
I have been learning a lot. I'm happy to see that Nashua and New Hampshire, they are focusing on the housing issue. There's a lot of assessments that are being done, different reports and recommendations that are being put out. And as I get to talk with more community partners, I've been learning about different things that are impacted by housing that, I wasn't thinking about before.
Like what, for instance?
Childcare.
Yes.
So, home childcare settings are being impacted by increasing rents. Something else that was brought up was accessibility. So being able to even get into transitional housing areas or shelter systems, if somebody might be in a wheelchair, how many accessible options are there? So there's a lot of different things that go into it that you might not think of. So it's an umbrella.
Right.
And the main thing is the housing. So it's how do we address the housing to stabilize this, to stabilize that, to stabilize this. And again, it'll take a community effort and a city-led effort to do
Right.
so.
And we have seen models that work. So, like I said, I'm going to have Wendy LeBlanc, who is over at, she's under the New Hampshire, Southern New Hampshire AIDS Task Force. And so she right now happens to be the chair for our COC, our Continuum of Care. And, one of the models that has shown an evidence-based practice for when you take care of that basic need of housing, people can maintain their health. And we've done this with HOPWA, which is housing opportunities for people living with AIDS. And so Wendy over at Southern New Hampshire AIDS Task Force, they've run that program, and it provides housing stability for individuals. And so protecting their housing so they don't get evicted if, someone finds out that they have a positive HIV status or AIDS status, but also allows for them the stability that's needed when they have to take care for themselves, right? And so you're not going to maintain a medication regime if you don't have stable housing. You're not going to be able to maintain any recovery efforts for individuals that may have substance use disorder if you can't maintain housing. You talked about childcare. The other piece of that, if you have any type of chronic disease, you're not able to manage any of those things if you don't have stable housing. The other thing, you talked about the complexities, you can't hardly even manage maintaining employment if you don't have housing. And we've learned that from the work that we've been doing with individuals over the past, I want to say 9 months, because I really got involved at the, if you want to call it the boots on the ground level, when we were responding to, the encampments that we had in the area over by the railroad, going out and learning about some of the circumstances that individuals found themselves in as to why they ended up in those encampments. Rent was one, losing their housing because of not being able to, cover the rent, but then also with substance use, it's hard to maintain housing as well if you're prioritizing something else other than maintaining your housing, especially if you lose a job. And so hearing all those stories helped me understand all the more about the complexities that are related to housing or the loss of housing, just as you've mentioned.
And to add to that, something that I had come across a couple of times in my previous position were individuals that are aging that have a criminal record. So that posed some additional barriers to housing, finding something that was accessible that would accept somebody that has a criminal background.
Yeah. And then if you're, and that's because that's tough for landlords, right? So there's that other component to it as well, right? And so even sometimes if we find, housing for folks, if landlords find themselves in a situation where they can't trust that the rent is going to be paid, it makes it harder for them to want to rent to a person who doesn't have stable employment. Right. And so then that makes, again, you get into this whole sequelae of events, this vicious cycle, of complexities for individuals, landlords, property managers, the whole gamut. And so with all of that understanding, Latonya, what is your plan?
Well, I think it's easier said than done, but I do think that there needs to be education on both ends, and there needs to be some trust building on both ends. So building trust with landlords, incentivizing them to rent to individuals that are under these circumstances, because as we know, more housing needs to be developed, but there are some apartments available. So we really want to incentivize landlords to accept individuals under these circumstances and work with our community partners to kind of wrap around care and support needs to ensure the continuation of care and helping these folks maintain that housing.
Yeah.
So that would be one step. And then the other step would be working closely with developers and the community and the city on making sure that, you know, there are areas where they can develop, incentives to develop affordable housing and offer these to individuals that are in need.
Yeah. So you're going to be working with quite a few folks within the community, within our municipality, you know, at the state level as well, which is great.
Yep.
And there is a lot of movement around this, as you mentioned, you know, from the state level down to the local level. There is a lot of attention being paid to this, right? And so that makes me really excited about the work, you know, that we're going to be doing, because people are really vested and invested in this across all levels, even at the federal level. And so there's been some money that's come through from the feds to support homelessness through our continuum of care efforts. And so we'll see that kind of roll out in the course of the next couple of years. And there's quite a bit of housing development that is going on. There's over 1,000 units that have been approved to be built right here, just, you know, in Nashua. So we're going to see more housing become available. I think the plan that you talked about as far as meeting and learning more about what landlords' needs are and trying to put in place incentives or developing a landlord incentive plan or program is something that's also really, really important. And there's legislation now that's going through at the policy level that will help support some of these efforts as well. So I think you landed in a good space where there's quite a bit of support, you know, that is for these efforts. There's a couple. Have you read the book Eviction, or have you read that yet? I have a nice little library of books that I think that you might want to read. You know, as you get into your journey, you know, in this course of work. So
it's on the to-do list. It's on the to-do.
It's on the to-do, and so I think other folks should read that too. So I'm going to encourage other folks to read Eviction as well, and then also Rough Sleepers. Have you read that one yet?
Not yet.
Okay, so you got
I've got some homework. I've got some homework.
Yeah, you've got some homework. So you know we do have a long weekend coming up.
We do.
So we have a 3-day weekend, so you can read one of those. You can read one of those books. I mentioned Rough Sleepers because I had the opportunity, Latonya, to attend an event that was put on by St. Anselm's College and the Center for Ethics and Society, because this is an ethical dilemma as well. When we see the number of individuals, you know, that are unhoused, and, you know, WMUR is running this whole campaign, The Faces of Homelessness, because it's not, you know, typical things that we think land people into homelessness. It's not, you know, and the individuals, you know, represent all different types of, you know, stories. But one of the things that we had an opportunity to do, Matt Sullivan, who is the community development director, and myself, we attended a conference. Well, it was a roundtable forum, and it was a really good conversation, and it was entitled Signs of Hope. And so that's what I'm looking forward to, the signs of hope that we have in addressing this issue that is impacting vulnerable members of our community, those who are older adults, those who have mental health issues, those who are impacted by substance use disorder, children. And so I see the signs of hope, you know, in the city having this position and having you on board to address this crisis, because we have to do something sooner, you know, than later, or it's just going to continue to compound and impact more and more people. And so Jim O'Connell, who wrote Rough Sleepers, was actually there at the forum and talked about why he, as a physician, started to do the work that he did by going out into the community and meeting individuals who were sleeping outside. They called it rough sleepers because they slept on the cement outside. So not even people that had were living in encampments or tents, but actually were sleeping on the stone ground, on the stone steps, and just some of the work that he did. And so, you know, I'm hopeful, right, that we're going to be able to make some forward movements with the plans that we have.
I am too, and I'm very excited to have this opportunity, and again to collaborate and meet everyone, and really make a difference.
Yeah, so we're looking forward to it. So welcome on board.
Thank you.
You and the opportunity. So there's been some things already that you've already started to kick off. So do you want to take a few minutes to talk about some of those things?
Sure. So I have created a draft of a strategic plan for the city to move forward with addressing
And that is so exciting.
housing instability. So that's a huge one. And then, as you had mentioned, Matt, I'm working closely with Matt Sullivan. And so the city of Nashua received some money that is in a housing trust fund. So there's a housing trust fund committee that is working on a plan to distribute that money to community partners. They had put out a notice of funding availability, and it seems like there's been some interest
nice.
from community partners in applying for this funding to make a direct impact.
Yeah, so we're looking forward to all of those things happening and engaging our community, and so this is going to be good. So I hope that you're excited.
Yeah.
You've had 30 days. I hope it's been a good 30 days.
It's been a good 30 days, and it's been a moving 30 days.
It's been a moving 30 days.
So that's
yeah.
what's important. It's been a moving 30 days.
Yes, and I'm very impressed with what you've been able to get accomplished in the first 30 days. And so, again, meeting our city team and city leaders, participating with the COC. So that wasn't new for you. The continuum of care wasn't new, so you've known some of those partners. But then also making some of the connections at the state level, and then also getting connected with your counterpart over in Manchester.
Yes.
Adrian, am I going to say her name right? Bowen?
Bellowen?
Bellowen, yeah. So making those connections, I think that's all key, because the more that we can do things together collectively, I think the better and broader our impact will be in Nashua, the greater Nashua region, in our county, Hillsborough County as well. And then, that's going to impact us as well at the state level. So glad to have you on board.
Thank you.
I'm very excited.
Me too.
And looking forward to all the good things that are going to come out of this. So in our last little bit of time together, so we have our viewers that are here watching us on Public Health Matters. What are some of your hobbies? What are some of the things that just keep you invigorated to just keep on going? Because this is going to be an arduous, drawn out process that we have. But I know that we're going to do some good work. But what are some of those things that bring you balance?
So I have two children, Lorenzo and Carmelo. So they are 5 and 8 years old, and I love to travel throughout the state of New Hampshire with them. Last year we went up north, and we got to go to Clark's Trading Post and do a bunch of different things. I got to go to Storyland for the first time in my life, so I'm kind of living vicariously through them a little bit. Yeah. So that's the main thing. But I do enjoy staying active, going to the gym. And I enjoy going to concerts and music festivals. So I keep busy. I definitely keep busy.
Well, we're going to keep you busy as well. So make sure you keep all those things that keep you balanced right at the top of your agenda, as well as we work on addressing this housing crisis and creating stability for those who might be on the brink of losing their housing. It's been a pleasure having you.
Thank you. Thank you for having me.
Oh, thank you. So I'm Bobbie Bagley, and I'm reminding you to have a great day today and a better day tomorrow. And I'll see you on the next Public Health Matters.